So you want to become a nurse? You want to learn how to save lives? Well, here's the video just for you.
Hey y'all, my name is Taylor Bailey. I'm a pre-nursing major on the pre-med track and I attend Hampton University. Today we will just be talking about nursing, like everything about nursing from a LPN/LVN all the way to a nurse practitioner. I am no expert by any means. I am a college student learning as I go. So as I learn, I will give y'all my insight of what I learned. But if you want to learn how to become a nurse, please like, comment, and subscribe on this video. Plus, I did a Q&A on my Instagram story, and I'll be answering all those questions. So if you want to learn how to become a nurse and a successful nurse, please like.
Can we talk for a minute? Girl, I want to know your name. Can we talk for a minute? Girl,
If you're looking at this video, you have an interest in nursing, maybe possibly nursing could be the profession for you, or you're thinking about it, or you're not for sure. Overall, you just have some type of desire to learn about nursing. Let me give you guys a little background about me. I'm a pre-nursing major on the pre-med track. Basically what that means, my degree is in nursing, but I'm taking my prereqs to get into medical school. I don't think a lot of people know, or maybe some do.
You do not have to
Major in biology to go to medical school at all. You can major in nursing, art, education, like anything. What matters is that you take your prereqs to get into medical school and getting your volunteer hours and just taking your MCAT. This is a lot of stuff. I'm gonna make a whole different video about my pre-med course life later on. Right now I'm just gonna be focused on nursing. So yeah, so I decided to choose nursing because it still aligns with the medical field and you get to do clinical rotations when you apply to nursing school. So I felt as though I wanted to still be part of the medical field sense when I chose my degree plan. So that's why I chose nursing. And yeah, I just want to let y'all know, you do not have to major in biology. You do not feel pressured to major in that. Just make sure to do really well on your prereqs if you're going to medical school and every other thing to get into medical school one day. I'm gonna go back to nursing though. So there's so many routes to become a nurse, so many routes. You do not have to get your BSN to become a nurse, but typically hospitals want you to have a BSN, or even further sometimes if you want to do advanced practice and diagnose patients and actually provide treatment, you would go all the way to a MP. But if you just want to be a nurse, just to become a nurse, you can just do the LPN/LVN route. So what that is a licensed practical nurse or a licensed vocational nurse. And those are each 1-year programs. And after you complete the 1-year program, you will take the National Council licensure examination for practical nurses. And you're a nurse. If you just don't want to stop at that route, you can go to your ADN, which is your associate's degree in nursing. That is a 2-year program. You take more your liberal arts classes, such anatomy and stuff like that. And from a ADN, you can get your BSN. An LPN and LVN, you cannot jump from that to a BSN. You have to somewhere get your ADN in there, because a standardized way to get your BSN when you go to a 4-year college, you take your 2 years of prereqs to get to apply to nursing school, and then once you apply, you have 2 more years actual in the nursing program. So overall, if it was me or what I am doing, I'm getting my BSN because it is viewed more competitive. So that's what I would do if I was y'all. Now a BSN is actually a Bachelor's of Science in Nursing. This is a 4-year degree. This is what you get if you go off to school. Go off to college, basically go off to school. This is what you would get. And in order to actually get your license for that, you have to take your NCLEX for RN, which is the National Council licensure examination for registered nurses. Without taking any type of NCLEX, whether an LPN or an RN, you are not a nurse. You have to take those tests. Have to. So after that, say for instance, I don't want to stop at a BSN. I want to be able to have more autonomy, to diagnose my patients, have treatments, give them treatments and stuff like that. I would move to an MP. An NP is a nurse practitioner. This is an advanced nurse. They can have a lot of autonomy. They're basically like an MD or PA basically, but they still have to be looked over by the doctor. Like they have to be signed off. Like the doctor still has to check behind them and all that type of stuff. But they basically on the road making, and they be making that money too. So yeah. I like what I've been doing. If I was a nurse, if I wanted to pursue nursing like full way and I wasn't trying to go to medical school, I would definitely do an MP because you're almost the role of an MD, but you're still, you have more of the nursing background versus the going to medical school background. So actually, when you I remember when I took my class at Hampton University, Intro to Nursing, it tells you like the medical pyramid versus like the nursing pyramid and how like you can move up and stuff like that. And nursing's more the whole background of nursing is more for caring for the patient, and medical, like doctor wise, is more like the diagnosis, all that type of stuff. So an MP is a combination of the caring and diagnosis. So if you're interested in that, I would definitely do the MP route. Like definitely look into that. It's for you. And how to get to that, you would have to have your MSN, which is your Master's of Science in Nursing, or you can have your DPN, which is their Doctoral in Nursing Practice. And each one you can get, you both do the same thing. Both have to take the same type of test. It's just your doctoral, obviously, a few more years. I think it's 2 more years. Yeah, 2 more years of schooling because it's a 4-year thing. I'm positive it is. Quote me if I'm not, but I'm positive it is. So yeah, that is the overall field of nursing, of how to become from an LPN all the way to an MP. And overall, nursing is a big profession right now. Like a lot of people want to be a nurse. So if you want to be a nurse, please go to school, go do it, put your heart and soul into it. There's going to be some long nights of studying, I know, but like with anything that you want, you got to work for it, but it's very rewarding. You work 3 days a week, off 3 days, or I think sometimes 4 days you have to work, and you have more time to spend with your family. So if you're looking for a practice where you can get money, and you can move up the ladder and make more money and then still have a life and still be with your family and stuff like that, nurse, I would definitely consider nursing. Another huge thing is when you take your NCLEX, if I am a resident in Nevada and when I take my NCLEX, I am taking it in Nevada, I am only licensed in Nevada. I cannot move to Florida. I cannot move to Wyoming and practice nursing unless I go through paperwork, basically. Now, if that state is part of the nurse licensure compact, I can just show my multi-state license and I am free to work in that state. That is a huge thing that you should know before you entered into the field of nursing. Big thing, big fact. Big fact. Hey, okay, so we're on the Q&A portion. Okay, so the first question is study tips. Big study tip. Take notes before the professor. What I mean by that, if a professor says, hey, we're not taking our learning chapter 1 until 2 weeks from now, you take notes right then and there over chapter 1. Because the more that you're familiarized with it and it's engraved in your mind, the more that you are able to master it and completely understand it. See, college is about actually understanding and not memorizing. Because when you go into profession, you want to know what you're doing versus, oh, I'm memorizing the different bones and stuff. No, you actually want to know the purpose behind the understanding of it. So if you are able to take time out and deeply understand, do it. And by that, when you take notes early, you're able to understand and you're not feeling as pressured or behind the professor. So that's why you take notes early. Another thing is go to office hours. As soon as you do not understand something, go. It's gonna save you sleepless nights. It's gonna save you tears.
That's so great.
It's gonna save you some stuff, okay? It's just gonna save you. Go to office hours. And also, you're able to connect with your professor more. and they can see that you genuinely like want to do well in the class. So definitely go to office hours. I definitely went, and it paid off. That's all I gotta say. It definitely paid off. Another question I had was, which professor has been the most helpful? I took General Chemistry 101 for nursing, and I took General Chemistry 201 for pre-med. I did equally well in both of them, but I will definitely say I really liked my General Chemistry 101 for nursing professor. He was just an overall good teacher. I had a lot of good teachers at Hampton, but I just really enjoyed his class. I did really, really well in his class. I think I almost got like 100, but I don't know if I got 100. I just know I got a really high A. Like, I did really well in his class, and I definitely take Dr. Noki for General Chemistry 101 for nursing majors, just saying. Okay, the next question I had is time management. Time management kind of goes with the previous question I had about the tips and tricks to me. I mean, not tips and tricks, the study tips I meant. Because the faster that you get an assignment done, or not the faster you get an assignment done, but the more that you're on your game and not procrastinating, the more free time you have. So that's how I time manage. I do my work, and I'm able to do whatever I please. So whether let's go to a football game, we have an event on campus, I just make sure I have my work done so I can do whatever I please to do. So that's my time management. Another question. Studying abroad as a nursing major, and if I know about it. So Hampton has an organization called MAPS, where you're actually able to study abroad. And they offer studying abroad. MAPS is basically a program for all future medical professionals that like want to go into the medical field, like whether it's nursing, PT, MD, PA, all that stuff. Like, it's a good program. Like, I would highly recommend anyone in the medical field to join that program if you attend Hampton University. I'm just saying. You can pay money to go study abroad, like at different places that they're offering that particular year. Sadly, I don't think we're able to do it this year due to COVID. I'm not for sure though, but I would definitely join that organization, MAPS. Yep, go to do MAPS. Another question. Do you test to the program after 2 years? So I think I may have went over this earlier, but I'm not for sure. Yes, you do. You do 2 years of your general classes, and then your other 2 years are when you apply to nurse school and do the clinical rotations. So here's how Hampton's broken down. You do your 2 years, then you take your TEAS test like your sophomore year. Your TEAS test you have to at least make a 70 on. A 70. I'm saying that again. A 70 on. If you don't make a 70, they won't even accept you. They won't even look at you. Make a 70 on that TEAS test minimal. You have to at least have a 78 in your science and math classes to even be accepted into Hampton's nursing program as well too. I'm not for sure if it's just your science and math class or if it's all your classes have a 78, but I'm pretty sure it's your science and math classes. But do well in all your classes. Do not shoot for a 78. Shoot for an 80, shoot for a 90, shoot for the highest grade. Don't do the bare minimum. I know some classes you may struggle in more than other ones, but do not shoot for the bare minimum. Do the best you can. And hopefully your best is above a 78 or a 78. And you at least have to have a 3.0 to apply to the nursing school. So definitely be on your game. Definitely go over those anatomy terms. Looking over the anatomy parts, your math classes, your reading comprehension, like all that stuff you need to know to do well in order to apply to nursing school. Like, I know college is gonna be a lot. You gotta know a lot of stuff, but really, if you really want to do something in life, nothing is ever too much to work for. So definitely put forth your effort in those classes. So, well, all your classes, but definitely just do well in college.
So this is Hampton's nursing degree plan. Do not mind the markings. That is stuff that I was just personally marking with because the classes I've taken, but that's the degree plan. Take it, screenshot it, do whatever you want with it. That's the degree plan for nursing for Hampton.
Another question I had was describe your typical day as a nursing student at Hampton. So I'm not a nursing student. When you're nursing, you're actually in the nursing program. I'm pre-nursing major. But hopefully I will be a nursing student when I take the TEAS test this year and I'll get an applied nursing school and become a nurse. But anyway, I just finished my freshman year and I'm currently a sophomore, but credit-wise, I am a second semester junior because I came to college with a whole bunch of hours because I took AP and DC classes in high school. Definitely take AP and DC classes. It helped me out a lot. I'm just saying, I have a lot of hours now. And I actually could graduate early, but I'm not because I'm still taking my prereqs for medical school, so I'm graduating in my year, which is 2023, which I was originally going to graduate anyway that year. But my typical day as a pre-nursing major is I go to class, take a nap, hang with friends. If there's something to do on campus, I'll go to that, and then I'll come back and study. But actually, I probably, before I even go hang out with friends, I'll probably do a little homework before that I know I can get out the way real quick and then go hang out and what I mean by hang out with friends during the school week is go to the caf or something like that, or if there's an event going on, go to that. But I don't do nothing major during the school week. That's just strictly for learning. The weekends I'll go out and stuff like that because it's always good to refresh your brain and stuff like that. But that's a typical school day. And majority of my classes were in the morning. The only later class I had was my intro to nursing class, which you will take your sophomore year. I just took it my freshman year because I said, I came in with a whole bunch of hours. So I was able to take classes for actually the second semester really in my first semester. So yeah, my schedule is all over the place really. But and that class was actually in the nursing building for Hampton, and you had to wear your scrubs when you go to that class because you're in the nursing building. You cannot enter into the nursing building without a scrub or some type of professional wear. Hampton is very big on that. They will send you right back. Even if you have a small question, they will send you right back until you are dressed appropriately. No ripped jeans. You dress professional when you enter into the nursing building. Just a heads up. Okay, another question. How are you preparing to get into nursing school? The nursing program. So I'm preparing by, I'm going to actually buy a book this summer for how to prepare for the TEAS test so I do well. There's no doubt about it. Going over anatomy. I recently just took anatomy too, so yeah, that. So I'm just going to go over all that, refresh up on math again. Just refresh up on stuff that I know I need to know. So that's how I'm gonna do it. Another question. How is my study habits? Okay, it depends on the class, to be honest with you. If it's a class I know I need to work for, I study for that test maybe 3 weeks before. I'm just putting it out there. If it's a class that it's not too demanding, I'll probably study maybe 2 or 3 days before. But that's kind of my study habits. And I watch YouTube videos. Khan Academy. What else is a good thing? I don't know. Really Khan Academy really helped. I definitely look at that on YouTube. I'm just saying that really helps out a lot because it breaks down what you need to know. If I think of any more websites, YouTube videos, I'll address them in another video. But I definitely use Khan Academy to help me study a lot. Another question: does my rigorous course take away from being with friends? Yes and no. Yes, there's some days I'm telling my friends I cannot speak to you until so-and-so day because that's the type of person I am. If I have something really big, a test, I will go MIA for a couple of days till I know I'm gonna master this test, and then I'll come back and regroup. So, but yes, I'm still able to hang out with friends. I'm not just ooh, I'm at least studying, because it's very important to have social interaction and have friends there to support you. So yes and no, like I said. How was my first year as a pre-nursing major? Phenomenal. Hampton University is the best school to go to. Go there. Best HBCU in America. That's all I got to say. So next question was, what is something I wish I knew before I became a pre-nursing major? Maybe that I had to buy my own scrubs, and that in order to travel to like the different hospitals for clinical rotations, I have to provide my own transportation. And those clinical rotations could be like get to be at the hospital like at 6 o'clock. So definitely, maybe that's like three things I wish I would have knew before becoming a pre-nursing major. But overall, it's not a big deal. Like having to buy your own scrub, being at the hospital at 6 a.m. or having to buy your own transportation. Like that's life in general. Like what you gotta do. But I really, really, really hope that y'all liked the video and that y'all got some insight into becoming a nurse. Comment below what video y'all want to see next time. Just saying. And thanks for listening to Talks with Taylor. Bye.